I'm Cassandra Palmer, and here are my notes. How many of you have encountered an autistic person in your everyday life? Autism is a complex developmental disability. By understanding autism, you will be better able to interact and understand autistic people that you come across in your everyday life. There are 4 important aspects of autism that we are going to talk about today. The first aspect is biology. The second are symptoms of autistic people. The third is theory of mind. And the fourth are different treatment aspects one can choose when dealing with autism. Let's examine these aspects. First, biology. When we're talking about biology, we're talking about the biological causes behind autism. Although there is no proven cause for autism, there are many different theories out there about why autism occurs. One of these theories is that children who develop autism did not receive proper breast milk during the breastfeeding period from their mother. Another theory is that autism occurs as a side effect of mothers using birth control prior to pregnancy. And the third theory out there is that people become autistic due to the exposure to toxic chemicals in household items such as cleaning products. Although a cause has not been determined for autism, the symptoms are easily recognizable. One aspect of the symptoms is in the social realm. People who are autistic have great difficulty with pretend play. So this means they have a lot of problems with their imagination and acting out different scenarios, such as playing house. They would have a lot of problems with this. Second social problem that autistic people may face is having problems with conversation, starting conversation and carrying out a conversation, and all aspects of conversation. A third problem is eye gaze. Autistic people are a lot of times unable to adjust their eye gaze to what another person is talking about or pointing to. A fourth problem with in the social realm of autism is that autistic people a lot of times treat other humans as objects in their world instead of fellow human beings. Other symptoms that go along with being autistic are behavioral. One of these behavioral problems are that autistic people have many tantrums. These tantrums can come out of nowhere and be completely unprovoked. Another behavioral problem is aggression. Autistic people are known to, at times, bite or attack, and a lot of the times it is unexplained. The third behavioral problem that autistic people face is that they sometimes become too attached to objects in their world. Although symptoms vary across autistic people, all autistic people somewhat lack theory of mind. This is the ability to make inferences about what others think and feel. So, for example, an autistic person, if they hit someone, may not understand that that person will feel hurt because they have a lot of problems about recognizing other people's emotions. So this can lead to a lot of strained relationships and inability to form relationships. To help these symptoms, there are many treatment methods that one could use to treat autism. The first is occupational therapy. The main focus of this would be to work on relaxation and body control. The main goal would be to help the autistic person feel composed and relaxed in their everyday life and therefore not be as prone to tantrums and things such as that. A second treatment method is behavioral therapy. The main goal of this would be to stop inappropriate behaviors from happening and to help healthy interactions occur between an autistic person and the people that surround them in their environment. And of course, the main goal would be to eliminate all these behaviors. A third treatment is to control the environment in the autistic person's life. This means eliminating any unnecessary stimuli. Also, a routine implemented in an autistic person's life can greatly help their everyday life. It can reduce stress and eliminate a lot of anxiety. So the goal of controlling the environment would be to create the optimal environment for the autistic person to succeed. These then are the 4 important aspects. Let me summarize. The 4 important aspects when talking about autism are biology, symptoms, theory of mind, and treatments. By knowing these key aspects, you can better understand the autistic mind and be in a better place to interact and understand an autistic person when you encounter them in everyday life. Thank you.